Did you know that you can watch the Senate live on YouTube? Visit the channel by browsing to youtube.com/@Senate of Virginia. That's youtube.com/@Senate of Virginia. Senate Committee Room, A305. This is the Senate of Virginia, Richmond, Virginia. This is the Senate of Virginia, Richmond, Virginia. Senate Committee Room, A305. Did you know that you can watch the Senate live on YouTube? Visit the channel by browsing to youtube.com/@Senate of Virginia. That's youtube.com/@Senate of Virginia. Senate Committee Room, A305. This is the Senate of Virginia, Richmond, Virginia. This is the Senate of Virginia, Richmond, Virginia. Senate Committee Room, A305. Did you know that you can watch the Senate live on YouTube? Visit the channel by browsing to youtube.com/@Senate of Virginia. That's youtube.com/@Senate of Virginia. Senate Committee Room, A305. This is the Senate of Virginia, Richmond, Virginia. This is the Senate of Virginia, Richmond, Virginia. Senate Committee Room, A305. Did you know that you can watch the Senate live on YouTube? Visit the channel by browsing to youtube.com/@Senate of Virginia. That's youtube.com/@Senate of Virginia. Senate Committee Room, A305. This is the Senate of Virginia, Richmond, Virginia. This is the Senate of Virginia, Richmond, Virginia. Senate Committee Room, A305. Did you know that you can watch the Senate live on YouTube? Visit the channel by browsing to youtube.com/@Senate of Virginia. That's youtube.com/@Senate of Virginia. Senate Committee Room, A305. This is the Senate of Virginia, Richmond, Virginia. This is the Senate of Virginia, Richmond, Virginia.
Good afternoon, and we are back here with the School Health Services Full Committee. And with that, we welcome everyone both online and in person, and we'll start with a roll call.
Delegate Cohen.
Here.
Delegate McQuinn. Delegate Walker.
Here.
Delegate Cousins. Present. Senator Peake.
Here.
Senator Perkarski. Rebecca Bowers-Lanier. Dr. Michelle Boyd. Angela Moore.
Here.
Dr. Lee Vreeland.
Here.
Betsy Looney. Superintendent Gullickson. Commissioner Shelton. Delegate Cherry.
Here.
Senator Favola.
Awesome. Thank you so much for that. And we're going to begin today's meeting with a review of our subcommittee meeting that met this morning for Senate Bill 1303. For a quick reminder of you, that is the bill by Senator McPike that deals with type 1 diabetes students and the role of the nurse and the school division in terms of how the treatment's going to take place for students that have that disease and making sure that they're safe. We had a very robust discussion. We went for just over 2 hours this morning. Heard from many advocates, both in person and online. Senator McPike and Senator Favola joined us remotely and had a wonderful discussion. I will note, if anyone is watching this but didn't watch this morning, that will be available online for review whenever the Senate gets around to putting it up. We in the House are much more efficient, I love to remind them, in getting those things available for review, but it will be available for review. If anyone has any comments they would like to add to that, you can email those to us, and we'll be happy to distribute those amongst the other members of both the subcommittee and the full committee. But I had a wonderful time with that this morning. And then with that, we're going to go to the next item, which is a review of legislative proposals relating to public school student education management, and that'll be DLS Mr. Brimmer.
Thank you, Mr. Chairman, members of the committee. I think one of the neat things about this committee, not only do you obviously review bills from the previous session, but you come up with a lot of good ideas for the following session as well. So members approached me between last meeting and this meeting, and I have two of those types of proposals for you to consider here today. So the first one came to me from Angela Moore. She kind of looked in the code and realized that the various provisions we now have in the code relating to student medication management, student health management, kind of generally, are never entirely clear that those provisions would also apply to any pre-K students that may also be attending in that public school building. So what we did was really just go through and add in references to pre-K students in each one of those spots. You have a copy of the bill draft in your packets to review. I think the provisions kind of speak for themselves. I'll just very briefly read you the summary of that bill, which is that it clarifies that certain provisions of law relating to the administration of epinephrine, undesignated stock albuterol inhalers and valved holding chambers, insulin, nasal or injectable glucagon, and opioid antagonists to public school students, and the submission of seizure management and action plans for public school students also apply to any student enrolled in a pre-kindergarten program in a public school. So that is that one in a nutshell, Mr. Chairman. The second proposal was brought to me by Chairwoman Favola. I'd put this one in the category of things that are creative solutions to try to get more registered nurses in schools. So what Senator Favola asked me to do was to amend the provision of law in the code that establishes the at-risk program to include as a permissible use of those at-risk program funds any initiatives that would support both the physical and mental health of students in public schools, including the hiring of registered nurses. If you're not familiar with the at-risk program, that's sort of an SOQ add-on that school divisions get to support students who are educationally at risk. Both the code and the budget set forth specific enumerated uses for that add-on that school divisions get. So this is simply not increasing or decreasing that pot of money, but saying that you can use that money as a school division if you see fit to provide for the health of students and possibly hire registered nurses with those funds. So that's all I have today, Mr. Chairman. If you were here this morning, it's been kind of a long day, so I don't want to speak too much. I'll turn it back over to you, but I'm happy to answer any questions.
I was going to say, if you'll hold right there, and I'll open it up for questions. Anyone who's present with us here that has any questions? Delegate Cohen.
Thank you very much. Mr. Bremer, do you think, I know that in code a couple of years ago, we certainly have had it as a goal to have a nurse in every school. And those goals have not been able to be met, A, because of the number of nursing positions that we need to have filled, but also because we have a lot of school systems who aren't able to, a lot of county boards that aren't able to fund that. So do you see this as, I think to Senator Favola, it's a clever way, I think, of being able to use money that already exists that really goes hand in hand with what we were already trying to accomplish as a legislature. So do you feel like this is in simpatico with what we're already trying to do in schools?
Mr. Chairman, Delegate Cohen, yeah, I think this is very similar to what you did last year. You went through, you found an existing program, the nursing scholarship program, and said, well, let's use that pot of money, and you added more to that pot, which was great too. Let's use that to get some LPNs to go back to school to become RNs. That covered about 30 scholarships for this coming year, which was great. I think this is similar. It's just saying to the school divisions, you get this money if you see a need here, use it in that way as you see fit, and maybe you can get a couple more RNs where they're really needed. So yes. Yeah.
Delegate Walker.
Thank you, Mr. Chairman. So I certainly understand the need for the registered nurses out here. I was in a business meeting this morning in Lynchburg with some of our rural schools, and I brought that question up with some of the principals and leadership there. And there is a challenge there, and certainly when you get into more rural areas there. And while in the boot camp on Tuesday, I think it was, with Delegate Sickles, that scholarship money was brought up. And I don't know how much there is, and if there is enough to adequately go deeper south with as far as trying to find nurses in these school systems, because a lot of rural school systems are just barely, there, and understand the physical needs that these children have, especially in severe cases here. If we're not able to fulfill getting registered nurses or LPNs in these schools, then what other alternative is there that we could consider here? Or is that something we need to be looking at here in this bill?
Yeah, Mr. Chairman and Delegate Walker, I think the DOE and VDH have been very helpful in the past, providing us all the data that we need. Actually, in between the subcommittee meeting and this meeting, they also shared that all that data is now on a really nice dashboard that we've been looking at and admiring in between the meetings. So that's able to show you exactly where all the needs are. And yeah, I mean, unfortunately, we have heard through that, and this dashboard confirms that there are some completely unstaffed schools, some more understaffed schools with, I think they call them UAPs. They're just people who come in and do the best they can to help meet student health needs, but aren't necessarily licensed or credentialed. So yeah, I'm not sure that I have any specific solutions for you right now, other than we just need to keep looking at the data and figuring out either how to chip away at it, or again, maybe revisiting the bill that we looked at a couple of years ago. Let's just try to let's just try to have one RN in every school per the code. That has its own challenges. You know, it's subject to the local match through the SOQs, and schools have trouble affording that too. Even if you chip in, they have to chip in too. So it's a challenge, but you know, Senator Favola is just trying to look at existing things that we can use creatively to help, especially in those rural areas.
And if I
Carry on.
may, Mr. Chairman, and I certainly appreciate what the senator's attempting to do and what we're in need of here, but on your dashboard, if you have identified these school districts that maybe are lacking in providing that, and there's severe cases, then is there some other ways we can look at these children in schools that have, you know, pretty severe health issues in these rural areas? So that's, I know I keep bringing up rural areas, but it was expressed to me that there are some concerns, and I don't know how many of these particular schools may have children that need a nurse, an RN, or whatever it is. So maybe that's something we can look at later, is trying to determine and then prioritize where maybe some of these scholarships could go to help.
Yeah, I think that's a great point well taken. I think that dashboard, you know, I only looked at it for about 10 minutes. I guess it just came out yesterday, but it does really help you match the needs with the current reality of the labor market there. And so we can definitely look at that more in depth and try to come up with some more targeted solutions for those school divisions.
If it makes anyone feel, go
Mr.
ahead,
Chair.
Senator Favola, go ahead.
Sorry. Thank you, Mr. Bremer, for explaining my proposal. You did a great job. To Delegate Walker's point, I mean, this will provide additional flexibility to the schools that are challenged in terms of pulling together resources to pay for a nurse. And of course, sometimes the local governments in my jurisdiction of Arlington, the school nurses are paid for by the county. So there are lots of different avenues out there where you can find funding for school nurses. You just have to be creative. And then, of course, the labor shortage is a real issue too. I get that. But we're trying to open up as many avenues as we can so we can fill gaps.
Thank you, Senator. And to that point, I was about to make a comment. At a national conference this week with 39 different states. It's the same everywhere. Everybody's struggling with this. Everybody's struggling with how to man it, how to fund it, how to make sure that we are doing our part as the state to put those things in place and to do that. Does anyone else have any questions of council before we move on to the next agenda item? Mr. Bremer, thank you for your synopsis and for the work that you do for us. We're so grateful to have that. Prior to going to public comment, I did want to pause for just a minute and note that we have two new committee members that have been added to our commission. One of us here in person and one that's joining us virtually online. And since you haven't had the opportunity to be hazed yet, we're going to give you a moment to introduce yourself. Tell us who you are, if you represent an organization, and how you got with us. And we'll start here in person. If you'll, Ms. Looney.
Hi, my name is Betsy Looney. I've been in school health for over 25 years, and I'm a school nurse supervisor. And I've also done, I had a grant with the CDC where I did infectious disease control and training, especially during the COVID pandemic, and helped on the committee of the reopening of schools during the pandemic. So thank you.
Welcome. And then joining us online, I believe, is Miss, I hope I'm saying this right, Vreeland?
Yeah, close, very close. Breland. Hi, thank you. It's nice to meet all of you, and I look forward to being in person next time. I'm the president and CEO of An Achievable Dream, and my background is primarily in the mental health arena. We do a lot of work with trauma-informed care and mental wellness in all of our schools.
Welcome to both of you. I'm sure you're going to be valuable members of our discussion as we try to do the best we can with school and school health services. in this committee. So thank you and welcome. Next on our agenda, we have a slot open for public comment. Is there anyone in the public who is here in the room that would like to come and speak to the commission? Please introduce yourself, tell us what organization you're with if you're with one, and share your comments.
Good afternoon. I'm Catherine Haynes, and I'm the Health Equity Manager with the Virginia Interfaith Center for Public Policy. As Delegate Cherry knows, I was also on the school board in the delegates district, Chesterfield County, and that's why I continue coming every time you meet, because it's such a critical issue. But I was thinking, as you talked about this morning, I say that I got involved with this issue when I was on the school board because that was when it was so deeply felt. But the work actually started in 2018 when very well-organized, passionate moms of kids with diabetes, so this, I'm very familiar with the comment, actually had, I won't read it because you heard it all this morning, but they said, Catherine, you know, it's not safe if your child is diabetic. We have to have a nurse in every school. So I love that you heard that this morning. And I do think that having listened to Senator Favola's suggestion is a creative way, because again, having been on the school board, and I know Delegate Cohen knows this, because we're Dillon State, giving that explicit, right, and naming RN in the code, I do believe will help my colleagues, former colleagues, since I'm not on the board anymore. And I might also suggest looking to, because I think another thing that I always try to bring forth is sometimes in the community I hear it's behavioral health or it's a nurse in every school, as if they're two separate strategies. And I just think that, the literature hasn't yet made it into the public space. But it's happening, and we have one of our own in Virginia, Sherry Page Geyer, is a Virginia RN for over 30 years, spent more than 15 as a school nurse, and she actually recently got her DNP so that she could elevate her voice and fight for a nurse in every school. And I'll just shares how it really is mental health and physical health. She writes, access to a school nurse is important, as school-based RNs are often the initial point of care for both physical and psychological complaints, and she cites research. These trusted professionals make schools safer for everyone, both because they can address medical emergencies on site and they play a role in the triage and early intervention of mental health concerns, said the dean. She quoted the part of this was from the dean of Yale School of Nursing, Azita Imami, PhD and RN, an expert on healthcare equity and access. This aligns, she says, with what I experienced as a school nurse. An RN in every school would address access to care inequities, especially in rural communities, which are known to have more barriers to mental health treatment, and where the rate of suicide among 15 to 19-year-olds has increased by 74% over the last decade and is 50% higher than that of their urban peers. Additionally, as pointed out, she's quoting again, Dr. Imami again, meaningful interactions with school nurses, and this addresses our pipeline issue, right, help inspire the next generation of nurses, a critical need, especially in rural areas. So I'd love to attach in a budget amendment to this. I know I've sat through 3 DMAS presentations, so I know things are tight, but next year, hopefully we can have a budget amendment. And then the last thing I just wanted to put out there is, I'll give this to Ryan to give this to pass out, but this is a list of the schools that when I did the FOIA in October, were billing Medicaid beyond the IEP. And I think everyone should take a really close look at that list because it's small. I think it's only 43 out of 131 schools. And I still talk to superintendents that say that they did not know they can bill Medicaid for a nurse. They thought it was only within the IEP. They have cited the need for billing support. And so maybe a Section 1 bill or a budget amendment that directs VDOE, because maybe, I know how the system works. Sometimes if the General Assembly directs VDOE to do something, it's just like this language, right? Then VDOE says, I now have a mandate from the General Assembly. We're going to get moving on this. But I do think school districts need more support. And if they were to survey the 88 districts that are not currently billing Medicaid, they could figure out exactly what that support is. And there could be a future financial support from the state. And other states are already doing this. And that can help us get slowly to the goal, which I know we all share. And in times of funding is critical, we really do need to tap into Medicaid on an issue that we all support. So thank you. And I'll leave the article too that I quoted from, because she writes a lot. And those who work with UVA, I'm sure, can reach out.
Thank you, Ms. Haynes. Is there anyone else in public that would like to provide public comment here in person? Do we have anyone signed up online?
Mr. Chair,
Yes, ma'am.
I have a question.
Senator Favola, you have the floor.
Thank you so much. And maybe this is a question for Ryan Brimmer. Seems to me, I recall in one of our budget cycles, I want to say 2024, I'm not certain it was 2024, but we added language, I think, directing DMAS to come up with sort of a technical assistance technical assistance service, if you will, to schools, helping them draw down Medicaid. In fact, we may have also put it into the BHDS budget, which they deal with behavioral health services. And one of our initiatives in the General Assembly was very bipartisan, was facilitating school-based mental health services. I think as part of that initiative, we also directed the administration to come up with sort of Medicaid expert assistance available to schools. Now, I'm not sure if that language stayed in after it went through the conference committee, but if you don't have the answer now, could you research that for us for our next meeting?
Yeah, Madam Chair and Mr. Chairman, just trying to search the budget real quick to confirm. I'm also not sure if that made it in to the final, but we'll get you that answer probably later today. And if it didn't make it in, we can definitely look at that for the coming session.
Thank you. Because it's something that, Mr. Chairman, sorry, follow-up question. It is something that has come up repeatedly in the various meetings we've had, especially folks who sit on this committee and have crossover with Behavioral Health Commission and Joint Commission on Healthcare, because we're trying very hard to get services delivered to our young people. And the way you do that is to meet them where they are, which is in our schools. So I know this topic has come up multiple times. So thank you. If you can find the answer by the end of the day, wonderful. If not, maybe you can email it to the committee.
Thank you, Madam Chair. Do we have online comment?
Online attendees who would like to provide testimony, please raise your hand.
All right. With that, that concludes our public comment period. Is there any other business from our committee members here with us? Seeing none.
Another comment, please. I'm sorry.
Senator, I was getting ready to come back to you. I'm always going to give you the last word, ma'am. Senator Favola.
You're very gracious. Thank you. I would just ask Mr. Brimmer, as always, and I know that you've done this so diligently, if you could keep track of the issues that are presented to us so we can make a judgment before session. I don't know what meeting that will be, Mr. Chairman, if it'll be the November meeting or later, so we can make a judgment about what we want to endorse and what budget amendments we want to put in. So any legislative proposals like the one that came from Ms. Moore and my proposal on using the at-risk that at-risk pot of money, just keep track for us so we can make some determinations about what to endorse when it comes time. Thank you, Mr. Chairman.
He's giving you a thumbs up.
Okay, good. Thank you.
Ms. Looney.
I just had a couple comments. So I do know that the Medicaid, Amy Edwards is the Medicaid specialist, billing specialist within the state, and that there are going to have modules coming up that will be released soon. And a question I have is, my understanding is that when we bill for Medicaid, that it goes into one lump sum. I'm not sure all that money goes back to school nurses or school health services. So that's something that might need to be looked at. Are we commenting on the other bills now or not?
Absolutely. You may, yes.
Okay, so I would caution the bill that adds pre-K blankly into this statement, and the reason why is because early childhood has a committee, and they have early childhood specialists, and I would really reach out to them as they are the stakeholders for pre-K, because pre-K is a whole different entity than K through 12, and it covers different licensures, different regulations, and let them weigh in on that before we endorse this bill. And I'd also recommend that we reach out to Dr. Karen Shelton, because in this bill it states that she would have to write a standing order for pre-K. And that's something that she would have to endorse. So, and on the scholarships, I might be able to give you a little bit of information on the $300,000 that you generously passed, which is phenomenal to get an LPN to an RN. So I met with the committee yesterday, I believe, on that. And the goal of that is in November to have all the paperwork completed and applications so that LPNs can apply. And the first cohort to start would be January. And we understand that'll probably be a small cohort because it's just getting out there. And then in the fall semester, when most people do apply for school, we would have a larger cohort. And the money doesn't go away if you don't use it. It can be, so if they didn't use the $300,000 with the small cohort, it will, you still have available. So those are the comments that I have.
Thank you.
Thank you.
Senator Favola, last word before we get out of this place.
I really appreciate folks thinking creatively, and I think the comments that were just articulated regarding the pre-K are well-founded. So I guess, Ryan, we'd ask you to share the legislation with the stakeholders who really are responsible for the K through 12 policies and see what they say, because we certainly don't want to endorse something that's not squarely in our space. And then I would just caution members that, we don't know what we're going to face in the budget in 2026. It will be our biennium budget, but, Washington passed a bill that will have enormous impacts on many of our safety net programs. And when those impacts will take effect, how they'll be phased in, how the state is going to manage the phase in, and if we can continue to create a safety net for our residents will be a challenge. So I just want to lay that on the table. I'm sure you're all aware. I'm not telling you anything you don't already know, but we will be facing some real challenges in the budget arena. So thank you, Mr. Chairman, for filling in for me.
Absolutely. And again, as I expressed in our subcommittee meeting this morning, we're so grateful to have you with us, even if it's virtually, and we continue to pray for your healing as you go through your treatments, and we'll continue to do that. Seeing no further business on the agenda and no hands raised up on the dais, we adjourn this meeting.